Well, you're still here on Joy News Desk. Thank you very much for that. We can now check out some other stories from the northern region specifically, where the community of Kong is one with a lot of challenges. Talk of road, healthcare, you name it. Life there can be very difficult. For pregnant women, the situation is even dire. Access and healthcare in this community seems an insurmountable challenge as they need to travel some 25 kilometers to the nearest health facility. In the past 7 months, 5 expectant mothers had no choice than to deliver on the road on their way to a health center in a nearby town. Rafiq Salam has more.
In this community, they have a resident population of a little over 3,000 people, and the people have myriad of challenges facing them. And one of them is the inability to have access to quality health care. There's no clinic here, and the women here have to walk long distance in search of this quality health care here. And so I'm going to speak to one woman who went through that experience of accessing quality health care at Tuna. On her way, she delivered twins. Now let's move on and speak to the woman. Fatuma Mahama is a mother of 8, and she has been living in this farming community for her entire 40 years life. In fact, she delivered 11 children, but 3 passed on. On 2 of the occasions that she was in labor, she delivered 2 sets of twins, but one under difficult and mysterious circumstance. She delivered on her way to the Tuna Health Center on the back of a motorbike. She recounted what happened to her that fateful night, riding on the bumpy 25-kilometer road to the health center.
When I was in labor, I woke my husband up and he told me that he wasn't having motorbike. I shouted at him to go and beg from one Shakibu, which he did. On our way, I asked him to stop for me to attend nature's call. Immediately he stopped and I alighted from the motorbike. I delivered twins.
Going through that excruciating pain, she swore that she will never become pregnant again unless there's a health facility in their community.
We are not rich, and our husbands can't afford motorbikes. When you are in labor, your husband has to go begging from colleagues who are having nice times with their wives for you to be sent to the clinic. In that way, you inconvenience them. So I have resolved not to give.
Now let's go back to labor agitation related stories within the health sector. And you recall that yesterday the psychiatric nurses started their sit-down strike because they haven't been paid for the past year or more. And now news coming in indicates that these nurses have gathered in front of the Accra Psychiatric Hospital. My colleague Mamiesi Thompson is there. She'll tell us why this is so. Thank you very much, Mamiesi, for your time.
Thank you, Kemini.
Mamiesi, why have these nurses gathered in front of the hospital?
Yeah, this morning I came to meet about 20 nurses gathered in front of the psychiatric hospital. Their demands are that they be paid their salaries for 10 months, and that's all they want. They are not going back to work until the monies have hit their account. Speaking to some of the nurses, that's what they've been telling me. I've also been to the OPD, and that's where I'm currently standing. And patients, there's actually an emergency case right now where senior nurses are taken care of. I can only see about 2 nurses attending to this child. She's a child that is suffering from, I don't really know what, but she's lying down.
Obviously, she's
and
a
only
patient.
2 nurses hello,
I'm saying this child is a patient at the hospital.
Yes, she's a patient. But then all the other nurses are gathered in front of the psychiatric hospital, and it looks like there's a lot of pressure on senior staff who according to the junior nurses, have been paid.
Mamiesi, these nurses embarked on a sit-down strike since yesterday. Why did they decide to gather in front of the hospital to demand their unpaid salaries? Did you find out?
Shamini, I didn't hear your question.
I'm asking why they have decided to gather in front of the hospital to demand their salary arrears, especially when they had just embarked on a sit-down strike.
Yeah, I spoke to one Frederick who is leading them, and he tells me that is where they are gathering. They want people to see that they are not working.
Oh,
so that
I
their
see.
demands will be met. Yes, it's a way of putting pressure on government to pay their money to them.
Mamiesi, we'll leave it here. Thank you very much. There'll be more on this and many others, including GOSPAS, which is the Government Hospital Pharmacists Association's partial strike as well, in subsequent broadcasts when you make time to watch Francisca Kakra-Forson on News Today. But in a bit, well, a few minutes from now, I'll bring you JN Interactive. Please stay.